Good evening. It is April 7th. This is Tim Ashe, President of the Vermont Senate, here to give my evening update on Vermont's response to the COVID-19 epidemic. I'm going to start off with some news from the governor's office today, and then transition to talking about some of the reasons why it's so critical that people of all ages do everything they can to follow all of the orders that we have been receiving from the governor in terms of social distancing. So I'm going to begin with what might seem like a little bit of technical information. We often hear of disaster declarations. We think about after earthquakes and tornadoes and floods. And of course, right now we're in a pandemic disaster, both from a public health point of view and for our economy. So I'm going to start with the announcement today. The governor really did two things. First off, what he has said is that he is formally making a disaster declaration request to FEMA. FEMA is the national organization which provides support to communities and states when they have when they face particularly challenging situation. The threshold that a state or a community reaches when they seek FEMA assistance, when we wish to declare that we have an emergency, is that the circumstances are so big and so bad that they're beyond the control of the state to manage it on our own. And so we have to seek federal help, and that's ultimately what the federal government is there for, with its resources and scale in order to support the recovery of states. So the governor has formally requested a major disaster declaration, and that will bring with it many resources to help us get through this and to build back up. The second thing the governor did today is submitted a letter both to President Trump and to the Secretary of Defense. And this relates to activating additional people from the National Guard, Vermont National Guard, to serve Vermont's needs in this terrible time. Some people might be a little bit confused because we see images of Guard members at the Champlain Valley Expo in Essex who were building a 400-bed surge medical facility. The images don't really project just how many people have been called up to support Vermont's efforts in this regard. The actual number, out of a grand total of 3,000 total members of the Vermont Air and Army Guard, there have only been 70 people who have been activated and effectively out in our community supporting Vermont's response to this crisis. So with today's letter to the President and to the Secretary of Defense, Governor Scott asked for the authority to call up an additional 480 people. So from 70 to 480. Now, you may ask, well, why aren't we just calling all 3,000 Guard members to service? This is a crisis. We have everything from food distribution needs, secure transport of people who commit crimes in this time and need to get from place to place, secure transports of people who might contract COVID-19 and are instructed to be in an isolated area, and we struggle to find people to get them from place to place, construction of more medical facilities, all those things. We might say, why haven't we called up all 3,000 of the Guard members? Well, the short story is that many of the Guard members are actually in professions that are considered essential services anyhow. Many of them work in our healthcare system, whether it's as doctors or nurses or a variety of other really critical roles. Many of them are firefighters, police, first responders of different kinds. So if we were to pull them all as one large group out of their normal day-to-day lives and pull them into guard service, what we would be doing is strengthening on the one hand and then depleting the resources on the other. So the governor has been cautious about calling in new activations of guard members, and but today has called for another 480 to be activated. So now I want to spend a couple minutes talking about why the governor's stay-at-home order is so important. And I think I'll start by saying that one of the reasons why this is called coronavirus, and it's called a novel coronavirus, is that because we haven't seen it before, we don't really know how it behaves and the way that it spreads and what it would take to prevent further infection. So in those early days, I think you'll recall, as I do, that we were hearing that this was an infection that particularly older people and people with chronic illnesses were the ones who were likely to catch it. And while unquestionably it's true that individuals who have compromised immune systems, have chronic illnesses, people on dialysis and so on, while many of them are in a more, they have a much more high susceptibility to contracting COVID-19, it, I think, gave people the false sense that we did not have to worry about people who were not older and people who did not have compromised health in some other way. And so I'm going to talk a little bit about just who in Vermont has been testing positive, why it's important that we understand this and take precautions in light of the information I'm going to share so that we can prevent unnecessary suffering and unnecessary death. So as of today, there are about 575 who have tested positive for COVID-19. That's 32 more than yesterday. And as I've said in previous updates, the number of people who have tested positive does not mean that is the number of people who've actually been infected with COVID-19. That is just the number of individuals who have formally been tested and came back positive. Up until just about a week ago, if your symptoms were mild but not acute, you were not getting tested. You were being instructed to stay home and quarantine and be isolated for a period of time until your symptoms went away. So many people called their doctors or visited their doctors and were told, yeah, you probably have it, but you're not on the priority list to be tested. So go home, ride this out. But if your symptoms become more serious, then we'll check back in and you might have to go to the hospital. So that 575 is not the grand total of people who have been contracted COVID-19. Right now, 29 people are hospitalized today who have tested positive, and another 51 more are hospitalized in what we call under investigation of infection, which means their test hasn't come back yet, but they're hospitalized and we suspect that it is. So with each day, some of the people who are in that first category, hospitalized and test positive, will transition out. And then some of the people who are already hospitalized without a definitive test yet will slide over into that category. But here's where I want to talk about the real issue that I think people have to reckon with so that we can get out of this situation as safely and quickly as we can. So I mentioned that early on, we worried that particularly people who were older or people with compromised immune systems were the ones we really had to worry about. And of course, we do have to worry about those populations. However, I'm about to read off effectively a chart of the number of positive tests by age in Vermont. And I will provide the link to this information on the comments underneath this video after I've finished. But you'll get the flavor for my point as I read them out. I'm going to start with the older category and then work back to the younger category so that you'll see that this is an equal opportunity virus, even if it has worse symptoms for people who are older or more vulnerable. So people over the age of 80 in Vermont, there have been 59 positive tests for COVID-19. People 70 to 79, there have been 72 positive tests. 60 to 69 years old, there have been 95 Vermonters who have tested positively. 50 to 59, 105 positive tests. That's the largest of any of the 10-year age demographic groups. 40 to 49, 78 positive tests. 30 to 39, 81 positive tests. 20 to 29, 72 positive tests. And 10 to 19, 13 positive tests. So if I take just those under 49, it's about 240 to 250 out of the grand total 575 positive tests. Now, let me quickly articulate why I think this is so important to really take in and understand and act on. There's really two things going on. One is that for many when I say younger people, I'm going to talk just in relation to that time horizon I've just walked through, but let's say ages 10 to 49. Many of the people 10 to 49 who become infected with COVID-19 are likely to have less serious symptoms than older Vermonters would, which means that many people who were not feeling well had symptoms which were the hallmark of COVID-19, but were instructed to go home, to isolate, to self-quarantine, and ride out their symptoms until they felt better at the other end of it. So they do not show up as positive tests anywhere. The fact that about 40% or 30 or 40% of all the positive tests in Vermont means that some young people, their symptoms were so bad that going home and isolating or quarantining were not sufficient, and they rose up the priority list to get tested. That means it is likely that many, many young people actually were infected, just never were asked to take the test because they weren't prioritized on the state's list. So I bring all this up for one key reason. Many who have contacted me in the last few days in particular, especially with the beautiful weather we're having today, and it's really been quite nice as we transition into real spring. Many young people have been observed throughout the state, throughout the county I live in, congregating, playing basketball, hanging out in the way kids do. And we understand how stir-crazy people are. But as they congregate, if any one of them has been infected, maybe from a parent who works in healthcare, from one of the other friends, whatever it is, that means that young people who can pass on the infection effectively as vectors without even knowing it can be spreading it and leading other people to become ill. And so I know that it can be tempting to say, let the kids get outside and get some energy out and see their friends, and how hard it is for them to be removed from their normal social setting at school and sports and theater and all the other things. But right now, the stay-at-home order and all of the other precautions that the governor and the legislature have been encouraging people to take are to prevent infections which can lead people to get very sick or die. And the people who can transmit that infection are not just older people. It also includes younger people, including school-age kids. So I hope that if you're watching this and you have felt tempted to let the kids go out and hang with another group of kids because it's nice out and it's just easier than dealing, I hope you will think twice and at a minimum require them to wear a mask or take some additional precautions. But the best way we can get through this thing as quickly and safely as possible is to not believe that young people can't be transmitting this infection just like anybody else. So there's my soapbox speech about that. I do want to say one other word about the data that we have now. And as I say, I will post a link to the comments section of this today's video so you can see this data for yourself, which also maps it out around the state. But I mentioned that the 50 to 59 age group was the highest number of Vermonters who have tested positive. And on either side of it, 40 to 49 and 60 to 69, there are also very high incidence of positive tests. I suspect that one of the things going on there is that many of the people who work at certain healthcare facilities are prioritized for testing. I've mentioned that Burlington Health and Rehab and Birchwood Terrace, both of whom have had outbreaks amongst their patients, have either already or are about to have 100% testing of all staff. There were, I believe, over 20 at Birchwood who've already tested positive that were staff, and maybe something similar at Burlington Health and Rehab. So that's that working age population of people who might be RNs or LPNs or nurse techs or pharmacy techs who might be working in these settings, which I think explains why it's so high. And because the healthcare field, I think, skews a little bit disproportionately towards women in these professions, the statewide total of positive tests of 575 are 54% women, 46% men. That's despite national data, which says men are contracting COVID-19 at greater rates than women. So all of these numbers aren't meant to scare anyone, but rather to communicate that regardless of age, every person can be transmitting this infection. And so the stay-at-home order and the encouragement for people to stay in, socially distance, it doesn't apply to everyone but school-age kids. It really has to include them. So now I'm going to speak a little bit about what's happening in the State House tomorrow, and then have a couple quick updates to wrap, and then sign off for the night. So tomorrow, the Senate is going to be convening at 10:30 in the morning. The only business that we'll be conducting tomorrow is authorizing subsequent remote voting by the full Vermont Senate. So under our current rules, which is what governs the way the Senate operates, the House has their own rules, the Senate has ours. Everyone has to be sitting in their chair and behaving in certain ways to be allowed to participate and cast votes on behalf of the Vermont Senate. We know that that is not the healthy and safe way to proceed right now. And with technology at our hands, we can, during this crisis and state of emergency, use technology to conduct our business remotely. So tomorrow at 10:30, we'll be going in. There'll be 16 or so of us. There has to be just more than a majority of the number of senators. We will go in to authorize subsequent actions by the Senate done remotely by services like Zoom. And if you wish to view that, and this is going to be the most unusual Senate session I think that I will have ever seen, and I'll explain why. But if you go to the legislature's website, and I will put this link up as well, legislature.vermont.gov, legislature.vermont.gov, you will see on the right-hand side, it says all Senate business or something like that. And when you click on it, it will show you the link to a YouTube page that you will be able to watch the Senate live in action. This is the first time that will have ever happened, I believe, in Vermont history, that we will have a live video stream in that way. And it's also going to be unusual because we are going to have masks on. And it is awkward, to say the least, for the rather formal and sometimes stuffy Vermont Senate to have protective masks. I haven't decided if this is the one I'm going to be wearing tomorrow. I'm not sure it's quite my Senate style, but we will be wearing masks, and that is to protect each other and to model the right behavior for the rest of the state. And there will be cameras positioned to capture all the people who are in the Senate. As I say, there will be about 16 out of the normal 30. So this will be the first time the public will be able to watch a live YouTube channel of the Vermont Senate in action. It'll be like C-SPAN for those of you who, like me, occasionally can't sleep and watch C-SPAN or C-SPAN 2. And in subsequent days, when we actually debate bills, which will be done remotely and will be like tiles on a screen, you will be able to watch it in real time, and you'll see what a debate looks like. It will not have the same flavor of the way we normally conduct business, because it's just harder to do that when you're on a computer screen rather than in person. But you're welcome to watch right along, and you'll see a little bit of history tomorrow. It'll be unusual, strange looking. There might even be some bumps in the road. But one of the upshots, if it can even be called an upshot, is that while we do this work remotely, it actually opens it up more to the public than has ever been the case before. So I do encourage you to look at it. Now, the very first action we'll be taking remotely is likely to happen on Friday or Tuesday of next week. So Friday of this week or Tuesday of next week, and I'll mention that on my next video because I think we'll know by then. We're going to be passing several measures, all related to more flexibility to get through the COVID-19 crisis. One thing we'll be doing is allowing buildings and general services, they manage all the state buildings and properties, to kind of fast track the criminal background check system that they use before they're willing to hire anyone to do work for the state. There are lots of mini construction projects going up to create facilities to meet people's human needs right now, and they need that flexibility. We'll also be passing legislation to provide more flexibility for EMS and first responders, so that they can continue to serve through this crisis without having to deal with certain bureaucratic requirements that are either impossible right now or not worth the trade. Also extending licenses for lots of people in the trades who right now can't go through the normal state process to get them, but many of them are required to be performing essential functions. You can imagine someone who's a lineman working for electric utility, for instance, who has a license. It might expire tomorrow. Well, obviously they can't go in and do the normal process right now. We'll also be making changes so that people for the duration of the state of emergency can change their power of attorney and transfer deeds remotely but securely, because we know that these are some decisions that people make when they become ill or in anticipation of perhaps becoming ill, but right now they can't get into the courts, so they're sort of stuck. So we're going to give that flexibility. And then we will also be looking at an eviction foreclosure freeze for the duration of the state of emergency. It would still allow evictions for people who are committing criminal actions or creating unsafe conditions. But we know there are some people who are going to miss rent payments, and we don't want them to jeopardize public health by being out on the streets. Now, there have been, I think, 5 county courts so far that have said they are freezing evictions and foreclosures without the legislature even getting involved. So the legislature is really not creating the policy so much as making sure that the protections in place for business owners and tenants in Chittenden County and a few other counties are extended to all Vermonters. So that was a mouthful. Now, just a couple things. I want to commend the University of Vermont Medical Center and UVM for working out an arrangement so that all the employees of UVM Medical Center can park very close to the hospital instead of having to be off in some satellite parking area. I had been contacted about this early on in the crisis by a concerned employee. At the time, I was grateful to hear back from UVM MC leadership that they were going to be accommodating people. So it's taken a little while for it to be a full policy, but this should make the work lives of the people who are putting their necks on the line a little bit easier, and it's very welcome. I also want to pass on information. Orly, who runs the Vermont International Film Festival, alerted me to the fact that the International Film Festival, which is fantastic if you've never participated in one of their festivals or gone to one of their showings, they are doing a virtual series right now. If you go to their website, which is vtiff.org, so VT and then IFF.org, and you'll see the movies that they're showing. And these are curated in the same way they would do for their film festival. So you'll know that these are some of the world's highest quality films. All of them will probably be new to you. And it both supports the film festival, knowing that they've had to back off from their normal showings, and just a great cultural opportunity. So I hope people will go to vtiff.org, maybe take a break from Netflix or Amazon or Hulu or whatever else, and check out one of the curated films from the film festival. And then last, I just want to mention that the UVM Health Network has a thank you page where you can go to any one of the facilities that you wish to pass on sort of a general thank you to all the staff there. And then they're directing their own employees to check it out, I think, for obvious reasons, to keep their spirits up and to know that people are thinking of them as they do really critical work every day. I will post that link up in a second. That includes UVM and its sort of family of hospitals, some of which are not in Vermont, but most of them are. Also the visiting nurses who are affiliated with UVM Medical Center now. So definitely encourage people to check that out. So at this point, I'm going to sign off. I want to thank you for joining me again, and keep your comments and questions coming. They continue to be useful as I pass them on to the governor directly or to people in state governments so we can better meet people's needs during this very difficult time. I will be back tomorrow at 5:30, and I look forward to seeing you then.